Hello everyone, and welcome to another lecture from CyberMD. In this lecture, we'll be covering atrial flutter. Atrial flutter is a type of cardiac arrhythmia that affects the upper chambers of the heart, the atria, and is important to understand as a part of your USMLE STEP 1 exam. You should be able to recognize this in clinical practice as well. Today, we will be delving into the details of atrial flutter. Please be sure to like, comment, and subscribe so that we can continue to provide free medical education resources to students around the world. The causes of atrial flutter can be broadly categorized into structural and functional factors. Structural factors include underlying heart disease, such as hypertension, coronary artery disease, heart valve disease, and previous heart surgeries. In some cases, alcohol abuse and high caffeine consumption have also been linked to the development of atrial flutter. Functional factors include medical conditions such as low thyroid or hypothyroidism, and the use of certain medications such as antiarrhythmic drugs and digitalis. It is a relatively common cardiac arrhythmia affecting an estimated 1 to 2% of the general population. It is more commonly seen in older individuals, particularly those with underlying heart disease, and is more common in males than in females. Atrial flutter is characterized by a rapid and regular contraction of the atria, typically at a rate of around 250 beats per minute. This is due to the formation of an electrical re-entry circuit within the atria, leading to a repetitive atrial depolarization. The atria contract in a rapid and organized manner, producing the characteristic sawtooth pattern seen on an EKG. The clinical presentation of atrial flutter can vary from asymptomatic to severe symptoms. Common symptoms include palpitations, shortness of breath, chest pain, lightheadedness, and fatigue. In some cases, patients may also experience dizziness or syncope. It is important to note that many patients with atrial flutter may be asymptomatic and only present with the arrhythmia during routine examination. The evaluation of atrial flutter begins with a thorough medical history and physical examination. A 12-lead EKG is the cornerstone of the diagnosis and will reveal the characteristic sawtooth pattern of the atrial flutter waves. Additional tests, such as a Holter monitor at home or a transthoracic echocardiogram, may be used to confirm the diagnosis and assess for underlying structural heart disease. On an EKG, atrial flutter is characterized by a regular, rapid atrial rate with a sawtooth pattern in the flutter waves. The ventricular rate is usually irregular and may be rapid or slow depending on the degree of conduction through the atrioventricular node. The presence of other conduction abnormalities, such as atrial fibrillation or AV block, may also be seen. The primary goal of treatment for atrial flutter is to restore and maintain a normal sinus rhythm. This can be achieved through medications such as antiarrhythmic drugs, electrical cardioversion, and catheter ablation. Blood thinning medications may also be used. Antiarrhythmic drugs may be used to control the heart rate and prevent recurrence of the arrhythmia. In some cases, catheter ablation may be necessary to eliminate the electrical reentry circuit causing the atrial flutter. In the case that ablation is needed, it is most often taking place between the tricuspid annulus and the IVC. Blood thinners may be used to reduce the risk of stroke, as the blood pooling in the atria secondary to this arrhythmia may lead to subsequent clot formation and stroke if the clot is ejected into systemic circulation. Atrial flutter must be differentiated from other arrhythmias such as atrial fibrillation, ventricular tachycardia, and supraventricular tachycardia. These arrhythmias can have similar clinical presentations and require a thorough evaluation to reach a correct diagnosis. The prognosis of atrial flutter varies depending on the underlying cause, the presence of underlying heart disease, and the response to treatment. In general, individuals with atrial flutter and no underlying heart disease have a favorable prognosis, with a very low risk of complication. However, those with underlying heart disease and uncontrolled atrial flutter are at increased risk for serious complications, including stroke and heart failure. The potential complications of atrial flutter include, again, stroke, heart failure, tachycardia-induced cardiomyopathy, and worsening of the underlying heart disease. In addition, untreated atrial flutter can lead to progressive worsening of symptoms and a decreased quality of life. In conclusion, atrial flutter is an important cardiac arrhythmia that requires a thorough evaluation and appropriate management to reduce the risk of complications and improve outcomes. It is crucial for students studying for the USMLE STEP 1 to have a solid understanding of atrial flutter in order to accurately diagnose and treat this condition in clinical practice. Thank you for tuning in to this lecture, and please be sure to like, comment, and subscribe so that we can continue to provide free medical education to students around the world.